We move to the next speakers. I'd like to invite Dr. Brij Agarwal. He's talking about the effect of yoga experience on the outcome of stapled hemorrhoidectomy. Please, sir.
Good afternoon. Thank you very much. And it's a huge privilege to be standing here in presence of Professor Bruce, who is our Editor-in-Chief of Surgical Endoscopy. And since this session is on ventral hernia, I was surprised that how did my hemorrhoid top figure in this. What I see as common in ventral hernia and hemorrhoids is only raised intra-abdominal pressure, or the word pile has been used in a purely mechanical context in hernias when we say fat acts as a pile driver. As already introduced, I am talking about impact of yoga on outcomes of stapled hemorrhoidopexy. And we all know that stapled hemorrhoidopexy has become very popular, comparatively popular, because neither the surgeon nor patients prefer pain to their patients. And stapled hemorrhoidopexy, as per literature, is slightly less painful. Enough evidence in literature exists for the efficacy or beneficial effects of stapled hemorrhoidopexy for shorter operative time, shorter hospital stay, lesser pain, lesser perianal discharge, and higher patient satisfaction. But similar evidence is not forthcoming in literature when we see about pain while defecating, persistence of anal irritation, burning or pruritus, and patients' failure to discriminate between feces and flatus. And also evidence is not positive when we talk about ability to maintain perianal soiling or hygiene. Then rectal urgency stays a concern in stapled procedure. However, return to activity normally perceived as earlier, but literature is silent on this. All these negative things, or all these things where positive evidence is not forthcoming, are attributable to the integrity of pelvic floor and the stretch compliance of the pelvic floor. So we thought, the hypothesis was, if we improve the tissue compliance and contractility, the tone may improve and these symptoms might benefit. As we all know, in India at least, and in Orient, yoga is a discipline of targeted exercises at a particular area, so we thought it might help achieve it. It was a prospective study in 2 years. Randomization was done by seal-envelope method. Patients and surgeons were both blind to the procedure, and we followed the institution's guidelines for ethics and informed consent. All the patients who had bleeding hemorrhoids were included in the study unless they had any inflammatory perianal disease or their coagulation profile was deranged. All the patients underwent a routine pre-anesthetic evaluation for general or regional anesthesia. And all these patients, as we all know, the surgery is the last option, so they have already tried high fiber diet, knot straining and stools. Although in our study we again explained to them all these benefits and lessoned them about yoga for the patients who were selected for the yoga part. Endpoints for the study collected prospectively by an independent doctor were at the end of first week, second week and third week. They were any requirement of NSAID, or when the pain was more than 5 on 10-point visual analog scale, and or patient had painful defecation and the persistent of irritation, burning or pruritus in the perianal region. Also, we asked him to report any discrimination, any failure to discriminate between feces and flatus, as was told about rectal urgency, and we noted their return to activity. Appropriate statistical analysis was done. And this is what 100 patients who were randomized in 2 groups, control and study group. They were well mixed demographically in relation to their gender, age, clinical grade of hemorrhoids, and other concomitant symptoms, because indication to include was only bleeding. But all these patients had some other symptoms like prolapsing mass or mucus discharge, itching, pain, or difficulty in maintaining hygiene or having perianal soiling. Almost 2/3 of the patients were operated under general anesthesia, which was our preferred anesthesia, unless there was a contraindication or, the anesthetist wanted to rule regional anesthesia, only then the regional was used. And we saw a very significant, consistent and progressive improvement with the yoga exercises in relation to the pain after surgery and as well as pain while defecation. All these beneficial effects of the study group were statistically significant. However, the failure to discriminate between feces and flatus was not reported in either arm, although we know it is quite common, but maybe because of the social atmosphere of India, patients were not willing to discuss this. Anal irritation, burning and pruritus, they resolved in both the groups by end of the 3rd week. As far as difficult hygiene or maintaining hygiene in the perianal area or rectal urgency was concerned, there was a quantitative improvement in the yoga group, but it was not statistically significant. And the rectal urgency resolved within 3 weeks in both the arms with equal rate of improvement. Other things noted in this study was that urinary retention, which is common in such kind of surgery, was seen only in those patients who were operated under regional anesthesia. We had to reoperate 2 patients, one from the either arm because of the post-operative bleeding. However, they were taken to OT within 4 to 6 hours, and the staple line was found to be bleeding, which was strengthened with a suture. We sent all our excised specimens for histopathology to rule out any presence of squamous epithelium. And hence, we did not require any patient to be re-hospitalized. All of them were discharged on the same day, including those 2 who were reoperated. As we know from the literature that pain after hemorrhoid surgery is due to stretch on the sphincter, and the procedure for prolapse and hemorrhoids, the name for this stapled hemorrhoidectomy is based upon, premised upon, and probably disruption of vascularity, and they say it is physiological repositioning or proximal repositioning of the hemorrhoidal cushions, and the surgeon operates much proximal, 4 centimeters proximal to the dentate line, so he is not touching any sensitive part of epithelium. And as we discussed, the pelvic floor stretch, compliance and integrity is important to the post-operative results. We were studying the hypothesis on improving this by yoga, and literature suggests that mechanical stretch increases the levels of tissue growth factor beta 1, which is a good moderator of repair mechanism in the body. And literature says these benefits of enhanced TGF beta 1 levels are increased exponentially if the stretch is given cyclically. And literature also suggests that these effects are perceptible within a week with a 20% stretch if maintained for 10 minutes in 24 hours. Similarly, the levels of this enzyme and this chemical and the cellular matrix metalloproteases type 2, the biochemical activity in serum is recorded within 24 hours of starting these stretch exercises. And some studies suggest that even the non-contractile connective tissue attains some contraction. So as we know in Orient that yoga is a set of cyclical and tissue stretching actions, and which has been documented to help in breech deliveries, which involve the integrity and the functioning of the pelvic muscles. In lymphedema, it has been shown to reduce edema and improve lymphatic circulation. And we found that in literature it has been already been incorporated in as a good alternative therapy in painful chronic conditions. So early results of our study suggest maybe that yoga improves patient-reported outcomes somewhat significantly in procedure for prolapse and hemorrhoids. And we say so because it's targeting the pelvic muscle, because yoga used in this study is known as, in India as Mool Bandh. Mool is known as the back passage, Bandh is being closing. So Mool Bandh practiced by patient by rectal squeeze and the gluteal squeeze and relaxing it cyclically throughout the waking hours of the day. It's supposed to be helping the tone of the muscles in the pelvis. And there was a question to me which I don't know still till date, that is it same as biofeedback? Maybe in Western societies this is what we are achieving by way of biofeedback. Thank you very much.
Thank you very much. This people welcome to the discussion or comments. Do you use some endoscopy for assistance with this procedure? Never.
For the exercise parts?
No, for the PPH.
Yeah, we use anoscope.
Always you use an endoscope?
It is done through the endoscope, circular endoscope.
Okay. How long, how many hours should the patient continue or how long should the patient, continue the yoga exercise?
Like for the study group, it was started 2 weeks before surgery, and he will do it all his waking hours as long as he remembers, even after surgery, and resumes it as soon as he remembers.
Any other questions? Okay. Thank you very much.
Thank you, sir.